Hello, my name is Paul Wood. I am a student at Eastern Kentucky University College of Nursing in the FNP program. This presentation is for NSC 892 Evidence-Based Practice Project. The title of my presentation is Improving Glycemic Control in Adults with Type 2 Diabetes through a Structured Lifestyle Coaching Program. Now, within the body of this information, we're going to discuss how type 2 diabetes affects over 38 million Americans and remains the leading cause of cardiovascular disease, kidney disease, neuropathy, and premature mortality. Poor adherence to non-pharmacological therapies, including physical activity and dietary modifications, contributes significantly to poor glycemic control and increased diabetes-related complications. Many patients struggle with sustaining healthy lifestyles because, despite receiving standard diabetes education, evidence demonstrates that the structured lifestyle can improve the self management behaviors and reduce the hemoglobin A1C levels, which is one of our primary concerns in diabetes control. So the question arises in adults with ages 18 and older with type 2 diabetes receiving care in an outpatient primary care clinic, how does a structured lifestyle coaching program contribute individualized nutrition counseling and support with walking goals compared to the usual diabetes care alone affecting the hemoglobin A1C? So some of the things we want to think about is the theoretical framework that's involved. So the proposed interventions that are set out by a Pender's health promotion model are those that individualize motivation toward healthy promoting of behaviors, self-efficiency, behavior commitment, and environmental and interpersonal influences. So these are frameworks that help support structures for coaching, for nutritional counseling, and physical activity goal setting to promote this sustained lifestyle behavior changes and improvements, which would then affect the glycemic outcomes. Some of the interventions that are proposed are individualized nutrition, which we just talked about, but not only that, but the counseling and helping to guide what nutritions are important. Also, diabetes self management education and support, that's noted as DSMES, and also walking goals, having some type of Fitbit or pedometer, which would kind of understand how many steps you're taking a day or how much you're walking a day. And then also, what we would hope for within this framework is the follow up with coaching in weeks 4, 8, and 12. This would be part of a 12-week program. There's many different studies that have been conducted along this structured program. D'Olivia in 2024 went through a systemic review of meta-analysis to see how the meters of walking, the steps taker helps benefit the patient, also the increased physical activity levels, and then the demonstration of a reduction of the A1C. There's also another research by Maneri in 2023 that really talked about the strategies of reviewing the nutrition of the patients with type 2 diabetes and also the improved dietary adherence, the enhanced glycemic control, and the individualized nutrition counseling. There was also a third research study done on with the Americans Diabetes Association, which really showed that there was evidence-based clinical practice guidelines that were set in place for folks with type 2 diabetes and how this can help improve their lifestyle. It also found that these interventions within their lifestyle really set up a foundation for treatment for the patients with type 2 diabetes. So, the end, there was the recommendation of the nutritional counseling, the physical activity, and the DSMES. So, these three research study programs really showed the strong and consistent evidence supports structured lifestyle interventions as an effective method to improving glycemic control. It also helped in increasing physical activity, improving self-management behaviors, and the reduction of the A1C level in the patients who were adults with type 2 diabetes. So some of the things we want to think about is the implementation of this plan. We want to make sure our group is definitely eligible patients, so they would need to be 18 or older, have a diagnosis of type 2 diabetes, received care in an outpatient primary care clinic, and have a recent A1C study. The baseline of this study would basically be the A1C, the body mass index, blood pressure, and also the daily activity level. Getting that information as our baseline is very important. Part of the team that would be involved in this study would be the family nurse practitioner, the primary care physician, registered nurse, diabetes educator, registered dietitian, medical assistant, and quality improvement coordinator. So within this process, we want to have our interventions in place. So we want to identify the eligible patients, obtain the baseline measurements, provide individualized nutrition counseling, distribute the Fitbit or the guide, the measure for how many steps you're taking, pedometer, and also walking goals. We also want to provide them with DSMES education, and then we want them to have a follow-up visit in week 4, 8, and 12. This way, we then will reassess all the outcomes and analyze the results. So, our outcome measures are the primary outcome, which we would look forward to, is the reduction of the hemoglobin A1C. This is done through blood draw. The second outcome is a BMI improvement, blood pressure improvement, increased daily step counts, improved treatment adherence, and increased self-management confidence. So we will measure these different bullet points at the beginning, at baseline, in week 4, like we mentioned, week 8, and then week 12. And then those outcomes we will compare to the baseline values to determine if the interventions we have put in place are effective. So again, within our timeline, what we want to see is recruitment and baseline assessment. We want to see the lifestyle interventions and follow-ups and how those have helped and improved. And then the outcome evaluation and data analysis. Now, the long term after this 12-week steps is to continue the process, but also to measure these within month 1, month 3, and then month 4. Once we gather all this information within those months, we'll be able to see if our interventions been put in place for the patient has helped the patient and improved their overall health. Thank you for listening to my presentation on glycemic control. Hope you have a good day.